today we have Laney Pierce, who's come to be a voice for our alumni and talk a little bit about her time here and what we really picked people that we thought would be great role models for the community and shining stars from our program. So thanks for being here, Laney. And first, if you just introduce yourself and tell a little bit about your nursing career and education.
Hi, I'm Laney. I went to the technical college for my LPN in 2014 and graduated in 2015. I then worked at the cardiology clinic for a year, and then I went back for my BSN. So I did the LPN to BSN at Colorado Mesa. I worked at the hospital for almost 2 years, and now I'm the staff development coordinator for VOA.
Awesome. And you guys are busy and do such a great service for our community right now, especially right now, always. But tell us a little bit about why you chose to attend our program here in Delta.
Well, I had worked as a CNA before I went for my LPN, and I think the nurses who had gone through the program at the technical college just really were great nurses. I enjoyed working with them. I learned, so much from them while I was working as a CNA, and that was just, the kind of nurse I aspired to be.
Awesome. So I'm curious about your time here. We're kind of, as we go back and recreate the history, we sort of want to walk in the the day of a life of a student during the time that you were here. So tell us a little bit about your time as a student, what year you attended, anything you can remember about your class or your days or your time here.
So I started in August of 2014. So one of the first memories I have is when we had to practice different skills. I just remember how nervous I was to do sterile gloves. And, we had to do that in front of our instructors, and so just learning all the different skills. There was so much information that I learned during that time, and I just really enjoyed it.
Awesome. When did you guys, how many days a week were you in class and how many were you in clinical? Tell us a little bit about that.
I think our first semester, I think we were in class a couple days and clinical maybe just one day. I think we went 5 days a week. And then as we got closer to graduating, we had more clinical days than class days.
All right. And did you have a favorite class?
Probably Judy's class.
Okay. All right. And Judy, for those that may not know, taught our med surg, our big chunk, huge class, 5 and 6 credit hour class. So what do you feel you gained during your time at the practical nursing program? What most influenced you in your future career?
I think just, I gained so much knowledge over the year. A lot of it was, more critical thinking. So, I learned how to really critically think, how to look at things, how to maybe almost, prepare for something that could happen, and just really like being quick on my feet and thinking of solutions.
Awesome. That's always a good thing, and I'm sure you've used that.
Yeah.
All right, so one last question, and that is kind of to look at anything that stands out from your year as a positive memory or a funny memory or a story that you'd like to tell about your time here.
Probably the part that stands out the most to me was our leadership clinical rotation. So we did that, right before we graduated. So we had the whole year. And up until that point, we had been taking one patient or, just they were kind of easing us into it. And then when we did our leadership clinical, we got several patients up at Horizons. And so I don't know, it just really stands out to me because that's when I felt like, I'm really a nurse. I'm, taking this assignment. I'm, kind of like the kid gloves came off, like I'm really doing this. And, so I just remember that felt really good.
Yeah. And that was Jeannie Robb's class.
Yeah, it was.
She did a great job with that class.
She did. Yeah, I enjoyed it.
Yeah. Anything else you'd like to add about your time here or the school, or that you'd like other people to know out there that are listening to this?
Just I'm grateful that I went there. I think it, really shaped who I am as a nurse, and I learned a lot from the program, so I'm really grateful for it.
All right. Well, thank you for being with us today. I appreciate it.
Thank you.